What we're taught in medical school is breast cancer is bad luck. We're not taught that it's an environmental disease. We're not taught that it's a metabolic disease. We're taught that breast cancer is just bad luck.
Dr. Jenn is a board-certified breast surgeon and integrative oncologist who spent over 17 years leading the breast surgery program at Einstein Medical Center in Philadelphia. After a personal health awakening, she founded Real Health MD to help women prevent and heal from breast cancer using functional medicine. Dr. Jenn is also the creator of Perfection Imaging, a radiation-free breast screening solution. She hosts the podcast Keeping Abreast, where she explores holistic approaches to women's health with top experts, and Dr. Jenn is the author of The Smart Woman's Guide to Breast Cancer.
Breast cancer, even in mutation carriers, is an environmental and metabolic disease, and the only way to live well and healthy is...
Hi, my name is Chris Burris. I'm a longevity expert and the chief scientist at a lab focused on a longevity molecule. My primary focus is to help people live longer and better lives with science. Make sure to subscribe and share so you and your friends can live longer and better, so you and your friends can live beyond the norms.
Hi, and welcome to the next episode of the Live Beyond the Norms Health and Longevity Podcast. Do you know someone suffering or recovering from breast cancer? The statistics say you probably do. If so, make sure you stay tuned for this entire episode. Our next guest, Dr. Jennifer Simmons, is here to clear the air regarding breast cancer screening, and hormone replacement therapy's impact on breast cancer. A little bit about Dr. Jenn. Dr. Jenn is a board-certified breast surgeon and integrative oncologist who spent over 17 years leading the breast surgery program at Einstein Medical Center in Philadelphia. After a personal health awakening, she founded Real Health MD to help women prevent and heal from breast cancer using functional medicine. Dr. Jenn is also the creator of Perfection Imaging, a radiation-free breast screening solution. She hosts the podcast Keeping Abreast, where she explores holistic approaches to women's health with top experts, and Dr. Jenn is the author of The Smart Woman's Guide to Breast Cancer, which includes a foreword by Mark Hyman. Pretty awesome. Dr. Jenn, thank you so much for joining us today.
Thank you for having me. I'm delighted to be here. I have to edit out that intro a little bit, but only because I am not the creator of the technology that we use at Perfection Imaging. I am for sure the champion and the ambassador of the technology and the reason why the world knows about it, but I did not invent it. It was invented by a gentleman far more intelligent than I am named John Clark.
Okay, and so is your franchise called Perfection, and the technology is also Perfection, or what?
No, the technology is called QT.
So you are
QT
the inventor of Perfection. That is your franchise.
I am. That's
awesome.
True. That's true. I just don't want anyone to be confused and think that I am taking credit for that technology. I'm not that smart.
I think you probably are. You just didn't focus.
I'm a lot of things, but I'm not that smart.
All right. Before we jump into your area of expertise, I wanted to go further back, much further back. What was it like growing up, little Jennifer? Where did you grow up? What were your parents like?
Are we going to talk about my mother? No, let's not talk about my mother.
Yeah. This is how we get to know you and what drives you and what pushes you. But you also have a lot of control here. So you don't worry. If there was some event or someone you could pinpoint as the reason you ultimately became a breast surgeon, author.
No. I have a story for you.
Okay.
You get comfortable.
I'm taking notes. Here we go.
So I actually didn't find breast cancer. Breast cancer very much found me. I come from a breast cancer family. I come from a very big family. Every woman in my family got breast cancer with the exception of my mother, who had colon cancer. And I literally don't remember a time in my life where I didn't know about breast cancer. It was absolutely part of the fabric and the thread of our family, the tapestry of our family. Every woman in my family got breast cancer. And I had a first cousin. Her name was Linda Creed. So she was a singer-songwriter in the 1970s and 1980s. I'm seriously dating myself right now. She wrote all the music for the Spinners and the Stylistics. She was beautiful, brilliant, larger than life, lit up the room when she walked in, the queen of Motown Sound in Philadelphia. She was a really big star, big deal. She was literally a rock star, and she was my hero. So Linda wrote 54 hits in all, and her most famous song that she ever wrote was The Greatest Love of All. So she wrote that song in 1977 as the title track to the movie The Greatest, starring Muhammad Ali, but it really received its acclaim in March of 1986 when Whitney Houston would release that song to the world. And at that time, it would spend 14 weeks at the top of the charts. Only my cousin Linda would never know, because Linda died of metastatic breast cancer just 1 month after Whitney released that song. I was 16 years old, and my hero died. And her life, and ultimately her death, gave birth to my life's purpose, because I never wanted another woman, another family, another community to have to suffer the way that mine suffered. And I did the only thing I knew how to do. I became a doctor, the first doctor in my family. I became a surgeon. I became the first fellowship-trained breast surgeon in Philadelphia. I became the first oncoplastic surgeon in Pennsylvania, and I did this really well and for a really long time. And I did it long enough for my aunt to be diagnosed, and long enough for my mother to be diagnosed. And with all the writing on the walls, I'm about 15 years into my career, and arguably at the top of my career. And I go from probably being one of the most high-functioning people you've ever met to I can't walk across the room because I don't have the breath in my body. And I undergo this really intense 3-day workup. And at the end of those 3 days, I find myself sitting in the office of my friend and colleague and physician. And he tells me that I need surgery and chemo and radiation, and I'm going to be on lifelong medication. And believe me, I appreciate the irony here, that these are things that I say all day without hesitation or reservation. And yet when those words are coming at you, I can assure you they have a different meaning, and they did not land well with me. And you can call it whatever you want to call it. You can call it God. You can call it universe. You can call it whatever higher power you ascribe to and believe in. But all I could hear in that time and space was, there's something more. Go find it. Now, I am a conventionally trained physician working in an NIH accredited cancer program, running an NIH accredited cancer program, running the department for my hospital. I did not know of alternative medicine. I didn't know of any other choice, of any other approach. All that I knew is that I couldn't silence this voice. So I go on a journey. I refuse treatment. My friend tells me what I told thousands of women before when they asked what will happen if I don't treat my breast cancer. And I tell them that they're going to die of their disease. And my friend tells me I'm going to die. And yet I couldn't quiet the voice. So I go on this journey to figure out how I'm going to heal myself. This was a very selfish journey. This was not about, oh my God, how can I make the world better for my breast cancer patients? This was about, how am I going to live and raise my children who are not ready to not have me? My husband gets really mad that I don't mention him in that sentence and formula, but he doesn't listen, so it doesn't matter.
I will send it to him directly.
He probably still won't listen. And so God is good. And in very short order, I found myself sitting in a lecture hall, and this tall, lanky guy walks on stage, big toothy grin, and he introduces himself as a functional medicine physician. Now, I'm sick, and I need help, and I know it, but I'm still my snooty booty self. So all I can think of is, there's no such thing as functional medicine. What is this quack talking about? And then I remember that I'm there for a reason and a purpose. So I check my ego at the door and I tune in, and thank God I did. Because what I was going to learn over the next 2 hours was not only going to telescope how I was going to get well, how I was going to heal myself, but it was also giving me insight into how I was going to spend the rest of my life. Because I was very much meant to be in that seat on that day to listen to this man talk. And that's exactly why I got sick. I got sick so that I could take the blinders off that were installed so tightly in my conventional medical training, so that I could take those blinders off and see my true purpose, which is to heal millions of women and to prevent millions of women from ever getting a breast cancer diagnosis. That's my purpose. That's why I'm here. And the main thing that I learned on that day from the quack was Mark Hyman, by the way.
That's an affectionate
Like
quack.
now it seems ridiculous to not know who Mark Hyman is, but in 2016, not so much.
Yeah.
Right? Like, yes, he had a cult following, but if you Googled Mark Hyman in 2016, the first thing that comes up is quack. Right.
Well, what would you say about current breast cancer surgeons, right, practicing allopathic medicine? What percentage of them who are, practicing today would know of Mark Hyman? Right? Like, so it really, it's the fact that you went down the rabbit hole, which is why you're aware that a whole lot of people know about him, and still not that many people know about him. Right?
Yeah. No, you're absolutely right. Still not that many people know about him. In our world, it seems like heresy if you don't know who Mark Hyman is. But there are still a lot of people that don't know who Mark Hyman is. And I certainly didn't know in that time. But, he opened up my eyes to the fact that in conventional medicine, we are completely focused on the wrong thing, especially in the world of cancer. But, all chronic disease, in that all our focus is on the symptom, right? And in cancer, all our focus is on the tumor, but the tumor's not the problem. The tumor's the symptom of the problem. And unless you back up 10 steps and figure out what's driving that process, not only are you not helping that person, you're just delaying the manifestation of the next disease, right? And so I'm an early adopter and a quick start. So I got so excited that day and so hopeful about the future that I immediately enrolled in the Institute for Functional Medicine. And I spend the next 3 years just submerged in the study of functional medicine and healing myself. I probably could have done a much better job healing myself because I got a lot worse before I got better. So I urge anyone who is listening to this story, don't do what I did, right? Like, do as I say, not as I do, because everyone needs help. Every coach needs a coach. Every doctor needs a doctor. Everyone needs help. And you should never do these things alone, because it's very hard to see what's right for you. It's so much easier for an outsider to help you through this process. But in any event, once I got through my training and it was a 3-year process. It was like doing another residency.
Well, let me kind of back up a little bit here, because we're going down this path. One of the things is it's impressive that you didn't talk about your mother much. You were very concerned about having to talk about your mother.
If you want to talk about my mother, we can, but that's what my therapist is for.
So you talked about you had this 15-year career, right, in as a breast surgeon. You have this family history of breast cancer. Was it on your mind that like you were due to get breast cancer?
I spent my entire career waiting for the shoe to drop.
Okay, interesting. Did you do anything? Like, did you change any behaviors?
No, because what we're taught in medical school is breast cancer is bad luck.
Yeah.
We're not taught that it's an environmental disease. We're not taught that it's a metabolic disease. We're taught that breast cancer is just bad luck, right? It's just like the constellation just crashes in a way and poof, you get breast cancer, right? We give this ridiculous explanation that it's multifactorial and that there's nothing that you could do to influence it. But that is a narrative very intentionally created by this system that is grasping onto the last threads of, one size fits all treatment. Right? Because people are getting wise. People are getting smart to the fact that they have so much more power than they think. And they are asking questions, and the answers that were given are like it was for me, becoming unacceptable. I said to my doctor, if you can tell me why, then I'll go along with the treatment. But so far, you're not telling me why. And I don't believe that this is just bad luck. And I also don't believe, and I didn't have breast, I had thyroid.
Oh, okay.
So for me, I couldn't live without my thyroid gland. Literally, I couldn't live without it. So if you can explain to me why we should take out the organ that God gave me, that I need to live and I literally can't live without, and spend the rest of my life replacing it with synthetic hormone, if you can explain that to me, I will do it. And if you can't explain it to me, I'm going to go figure out how to fix this.
Yeah.
And I don't even know where those words came from because I didn't know of any of this. I went to a very conventional medical school, one of the top medical schools in the country, and never were we taught in any scenario. I'm not just talking about cancer, but in any scenario of chronic disease, never were we taught that we can influence it by our own behaviors. Like we were taught that diabetes is not curable, hypertension is not curable. Any of the chronic diseases that we now know we can reverse. Right? But we never talked about any of that. And our training in and around that, it was minuscule, either because literally the people that trained us didn't know, or, I hate to think it, but there may be some sinister committee there, let's not let this get out.
Yeah.
I don't know.
This is the best way for our pocketbook. And certainly the incentives are there. I try very hard not to kind of fall into conspiracies, but you also need to be aware of where the money is flowing. And that seems to be the case. So I had kind of listened to your story on a couple of interviews that you did, and I just got immense clarity because your cancer was in the thyroid. I don't think I picked up on that. Just got to ask, if you had breast cancer, would you have just done traditional things? Was it the fact that it was the thyroid that you were like, no, I'm not going without this?
Well, so there are no accidents, right? Like God gave me the disease that he knew would trigger that thought pattern in me. So I want to say that had my cancer been breast, maybe I would have just gone along because anyone can live without a breast. I'm not saying anyone should or wants to, but the truth is that if you remove someone's breast, you don't have to replace that. Anyone can live and live a full life, not necessarily a happy life. And I am not an advocate for mastectomy, and I am not an advocate for prophylactic surgery at all, even in mutation carriers, because breast cancer, even in mutation carriers, is an environmental and metabolic disease. And anyone who doesn't believe that, just look at the statistics. BRCA mutations are not new. That BRCA mutations have, just because we didn't discover them until when we did the Human Genome Project, doesn't mean they're new. They're not new. And people who had BRCA mutations 50 years ago didn't have the breast cancer incidence that we have now, which is in the 80 percentile, because our environment didn't look like that then.
Just real quick, the BRCA, that's a genetic mutation that kind of
that's associated with an increased risk of breast and ovarian cancer.
Okay.
And a significant increased risk above the general population because what the BRCA gene is, and all those hereditary familial mutations that increase your risk of cancer, they're all tumor suppressor genes. So the people that are born with those mutations have problems with DNA repair and the things that we know protect us from cancer. If you have a mutation in one of those genes, you're certainly more vulnerable. But the die is not cast. Your story is not written, and your genes are not your destiny. They are a roadmap. They are a guide for sure, but we can nurture our nature. We can control our genes, and we've seen that repeatedly, borne out in the literature and everywhere else. But you have to live a very conscious, awake life in order to do that. And you can't just not care and not pay attention to all of these environmental challenges and expect a good outcome.
So it makes perfect sense. So you all right, Mike, you see this kind of sham guy, right? Mark Hyman, right? You're like, I can't believe this, but I'm here for a purpose. You join their program, you get 3 years of education, of functional education. How would you compare and contrast traditional education versus functional education? And then maybe what should the education be like? Yeah.
So, the funny thing is, we actually get all of that education that is taught in the Institute for Functional Medicine or A4M or whatever these platforms are. We get that teaching our first year of medical school in biochemistry and stuff like that and physiology. And then we're told to forget it. It's like, oh, you just need to get through this, but then don't pay attention to it anymore, because starting the third year of medical school, you're taught to recognize a constellation of symptoms, give it a name, give it a diagnosis, and prescribe. Okay, so the first 2 years is let's really dive down deep and understand how the body works. And then it's but forget that, because we're just going to teach you how to override. So manage one symptom, wait till the next. Manage one symptom, wait till the next. And I think the glaring difference between the two worlds is that in our conventional medical system, it is entirely built on failure. Wait for the person to fail, mask the symptom. Wait for the next failure, mask the symptom. And the example is, you go to the doctor, they do your labs, maybe your fasting blood sugar is a little elevated, and what are you told? Watch and wait. Let's wait. You're not diabetic yet. Let's wait, right? Nowhere in that is, wow, you seem to be losing your metabolic flexibility. What can we do to optimize your health so that you don't develop diabetes, right? That doesn't exist in the conventional medical system. In the functional medical world, we are always talking about optimal function. So an example of that is most people go to the doctor. I think the number one complaint is fatigue, right? And so what happens? Your doctor will measure a TSH, right? A thyroid stimulating hormone level. And that's it. That's all they'll measure, right? And the TSH range just continues to grow and grow and grow, because the way that we do our labs is that we decided that 95% of the population has to fit within the acceptable range. So the acceptable range keeps getting bigger and bigger and bigger as our population gets sicker and sicker and sicker. In the functional medicine world, we're not interested in what 95% of this unhealthy population is. We are looking for optimal function. So our ranges of what's acceptable, and we would never just do a TSH for fatigue. I mean, fatigue sets off a whole host of bells and alarms for us. Yes, we're checking a full thyroid panel, certainly, but we're also looking at what is affecting your mitochondrial health, because mitochondria are where we produce our energy. And we're asking a whole host of questions, starting from the time when you were in your mother's womb up until today, trying to figure out what is affecting your mitochondrial health, right? So we are not looking for 2.5 standard deviations from the mean. We're not looking for you to just be okay. We're not looking for you to be average. We are looking for you to be exceptional. And we expect everyone to be exceptional. And we're teaching people to be exceptional. And that's the main difference. And what I have had the awesome and unbelievable privilege of doing, because I get women at their worst, right? I get women after they've heard the worst 4 words that you will ever hear in your lifetime, right? You have breast cancer. Worst 4 words you will ever hear. And I get to take them from that space to the best health they've ever had in their life. This is what's so amazing about this approach.
Which is a contrast to your 15 years in allopathic medicine, where you just got them through it and send them on their way. You weren't pushing them towards the best health that they've ever had.
No one ever gets healthier in the conventional medical system. Like, not even close. No one ever gets healthier, because who gets healthier after having a surgery, after getting chemotherapy, after being radiated, after wiping out all of your hormones, becoming menopausal prematurely, or if you're already menopausal, worse, right? Because they wipe out all of the hormone that you have. No one ever got healthier in any of these scenarios. And in fact, you get a lot worse. That's actually the title to my next book, which is called The Forgotten Woman, because we're taking all these women, we're treating them for breast cancer. We're saying you should be grateful to be alive, and they are grateful. So I don't want to take that away. They are grateful to be alive, but it is very hard to feel grateful when you can't think, you can't remember your words, you can't sleep, you're anxious, you're depressed, you're scared, your breasts are deformed or absent, your joints ache, your bones ache, you've gained weight, your clothes don't fit, you don't recognize your body, you don't feel like you've lost your confidence, you've lost your mojo, you have no libido, sex is unwanted and painful, your relationship is either suffering or absent. It is very hard to feel grateful when all of this is happening. And yet, this is how we are leaving women after breast cancer treatment. And we're just saying to them, just be happy to be alive. That doesn't feel like life. It doesn't feel like life at all.
It's interesting because last night I told you I went to a concert before we started, and one of the guys was a new friend to me, and he is a cancer survivor. I think he's 10 years in remission, and it was a bloodborne cancer. And one of the I like to ask these questions, right? Like, I do this. I don't just do this for the podcast. I do this when I'm out having a good time. And he was sharing, like, he's divorced. apparently cancer survivors struggle with divorce, and a lot of it is all those things you just mentioned. Like you've got brain fog, you're not yourself, you have emotional ups and downs. You're like, there's kind of no surprises there. So yeah, that's
It's a huge stressor on a relationship, and we don't talk about it. And we mostly don't talk about it because the way that we quantify success after cancer treatment is, are you alive? Right? Are you alive 5 years later? And no one is asking about the quality of that life. And in fact, when we look at what, at least in the breast cancer space, I haven't admittedly looked too much in the other cancers, but in the breast cancer space, once you treat a woman for breast cancer, you increase her risk of dying of other chronic diseases quite significantly. The number one is most women who get breast cancer don't die of breast cancer. They die of cardiovascular disease. And we don't talk about that. And cardiovascular disease is already exponentially the threat to a woman's life from the age of 30 on, well over breast cancer. And if you treat a woman for breast cancer, she is 2 to 3 times more likely to develop cardiovascular disease.
Let's be clear, traditionally treat, right? Because when you start getting into functional medicine, right? Like, yeah.
Yes. If you are traditionally treated, well, let's call it conventional, because the traditional treatment methods are what we're talking about, right?
Yeah.
But if you are conventionally treated for breast cancer, you increase the risk of cardiovascular disease by 2 to 3 times. So these women then go on to develop cardiovascular disease or cardiomyopathies, and they actually have premature deaths as a result. And yet, none of this is attributed to breast cancer, even though it should be.
The data is clear.
So the way that we view breast cancer, the way that we view breast cancer treatment is all wrong. It's all wrong. And it has nothing to do with quality of life. Why? Why should we be treating one disease and giving them something that's worse? And giving them a life that's worse? And my main objection to this, and I want to be clear, I am not saying that breast cancer is not a problem. I'm not saying that people don't die of breast cancer. Of course they do. I am not saying that we shouldn't treat any breast cancer. Of course we should. There are definitely aggressive breast cancers that require every single thing that medicine can provide. Right? I'm not throwing the baby out with the bathwater. I'm not saying that I never recommend conventional treatments. I do. Right? Like if you have a lot of tumor burden and your proverbial sink is overflowing, you got to mop the floor up, right? You can't stand there in the flood. You can't make any progress in the flood. So surgery, chemotherapy, radiation, even the anti-hormonal drugs for a period of time, that's the mop. That's mopping up the floor. But we can't be so busy mopping up the floor that we forget to turn off the faucet, right? And everything that we talk about is turning off the faucet. So there are absolutely times when you need everything. But my main objection is that we are overdiagnosing and as a result, overtreating. And it's not small numbers. It's up to 30% of the breast cancers that we are diagnosing are diagnosed unnecessarily. And these women would have never, ever had symptoms of breast cancer in their life. And yet, once they get a diagnosis and become a patient and get treated conventionally, we're accelerating heart disease. We're accelerating brain disease. We're accelerating bone disease. And we are diminishing both the quality and the quantity of their life.
Yeah. Well, let's talk about that a little bit. How do women typically find out they have breast cancer? Like, what is the path? And then I know that we're going to get into, what kinds of scans should women be just not experienced. What kind of scans women should be taking, whether it's yearly or whatever.
Screening.
Let's talk about. So first, how does a woman typically find out they have breast cancer?
Yeah, most women find out they have breast cancer because we're using mammogram to screen.
Okay, so it is
Right.
mammogram.
And
then
it's a really, really archaic, unsophisticated tool. And when
it's X-rays, right? A mammogram is actually
X-ray.
X-rays, right?
Yep.
And I think it's even a significantly higher dose, right, of radiation than a traditional X-ray. Is that correct?
Yes.
Yeah.
Yes. And it's not a uniform dose of radiation. So the more dense your breast is, the larger your breast is, the more radiation is delivered in order to penetrate those tissues. So people think that everyone gets a standard dose during a mammogram. It's not true. It's not true.
And conventional medicine says that you should, at this point, and I know that there was some debate about reducing it or whatever. What's the path of how frequently should women be getting mammograms according to conventional medicine?
Well, if you asked the question 10 years ago, the recommendations out of CMS were that you should start at 50 and screen every other year, but that the decision should be made individually between you and your doctor. And if you are at higher risk, you should start earlier and screen more often. And what the American College of Radiology recommends is that you screen early and often, right? Because breast cancer and breast cancer screening is big business.
Yes.
37.5 million screening mammograms done every year in the US, right? It's big business.
Okay, so 10 years ago it was about once every other year, depending on, your physician might advise and that's changed now?
Yeah. Now we're getting recommendations that are younger and younger. And we're talking about the importance of screening the population 40 and above, and maybe even starting earlier than that, because younger women are getting breast cancer. So we should be screening younger and younger. And despite the fact that there has never, and I want to stress this, never been a study that shows that mammogram, and especially in the younger population, has any positive impact on survival.
On actual survival.
Never been a study that shows that mammogram impacts survival. And if it does not impact survival, what are we doing? What are we doing? And why are we using a test that causes cancer to screen for cancer?
Hey, super quick break from the podcast. Hopefully you're loving it. This is a way you can support the podcast and take advantage of a great offer. We're offering 50% off of one of our MCT bottles. MCT is an amazing oil. Add the ESS60 molecule to it. It's even more amazing. All you got to do is leave a review on iTunes, send us a notification that you've left that review. We'll get you a coupon code that'll get you 50% off of our MCT oil and free shipping. Back to the podcast.
So most people would, on the surface, and I remember that when I first kind of heard about this, you think, okay, we're doing this screening and we're identifying if there is breast cancer there. What could possibly be wrong with this scenario? Like, what is the problem with screening? And I know you know. so please, like, what is this sounds perfect. Like, hey, if we're having breast cancer.
It does sound perfect. It's a very logical narrative that has been very intentionally created. So let me first say that when the mammographic screening program started in the 1970s, I really do think it started with good intention, and that it was built on this foundational understanding that breast cancer growth is both linear and predictable, And what that would mean is that breast cancer starts small, grows to some critical size, at which point it's more likely to metastasize. And if we could find it before it reached that critical size, we could save lives and save breasts, right? Sounds good,
Sounds perfect.
right? Sounds very well intended, sounds logical, right? It just doesn't happen to be true. Because breast cancer growth is neither linear nor predictable. So it's not like breast cancer starts small and it's a non-invasive, and then it becomes invasive, and then it becomes node positive, and then it spreads. It's not how it works. So breast cancer is what it is from the very beginning. So if it's going to be an aggressive process, it's going to be an aggressive process from the very beginning. And if it's not going to be an aggressive process, it's not going to be an aggressive process. And it doesn't matter. Either scenario doesn't matter when you find it, because the outcome's going to be the same. So the only thing that mammogram actually did was increase the number of breast cancers that we found, but it does not impact survival. So no matter how many mammograms we do every year, the same exact number of women die of breast cancer. It does not impact the bottom line. No matter how many mammograms we do, the same exact number of women present with aggressive disease. It does not impact the bottom line. But this is what it does do. If you use mammogram to screen, you will identify 20 to 30% of breast cancers that do not need to be treated, that would have never affected a woman in her lifetime. So just to give you some perspective, in 2024, we diagnosed 300,000 breast cancers in the United States. If we overdiagnosed by 20 to 30%, we're talking about 60 to 90,000 women who were unnecessarily treated for breast cancer. And the number one thing that we could do in this country to decrease breast cancer incidence is to stop screening with mammogram. First of all, some of those cancers are going to be caused by mammogram. And I hear this all the time. One mammogram does not cause breast cancer. Okay, I agree. One mammogram does not cause breast cancer. Who gets one mammogram?
Yeah,
right?
the prescription is one every other year.
Yes.
From age 50, now age 40.
Yes. So, and the truth is that now we're not recommending them every other year. We're recommending them every year. So if you start a woman at age 40 and you start to screen her until she no longer has good health, because that's kind of the end point. We don't have we don't say we're not screening after 70 or 80 or 90. We're saying we screen women until they no longer enjoy good health. So now these women are getting 10, 20, 30, 40, 50 mammograms. That's a lot of radiation. That's a lot of mammograms. And some of them are going to be the cause of breast cancer. But just statistically speaking, when you screen 2,000 women over 10 years, you may potentially save one life, maybe, but you will cause 10 women to be treated unnecessarily for breast cancer.
Does that include false positives? Because I get super geeky into the science of the actual testing, and there's actually false positives, and then false positives are a massive problem in and of themselves.
Yes, that does not include false positives. The false positives in those 2,000 women are 100. 100 false positives. So 100 of those women over 10 years will be called back for additional views, will be biopsied unnecessarily. 80% of the biopsies that we do in this country are for benign disease. Wow. 80%. 80%. We are only biopsying the correct person 20% of the time.
Wow.
This is
Okay.
terrible.
So there has to be a better way.
There is
Like
a better way.
that's your journey. That's why
Teed
you
me
ended
up.
up with with thyroid cancer.
And listen, I just want you to know this is not like the Jenn Simmons show or the Jenn Simmons opinion or anything. There is hard, indisputable data about this. We have known since 1977 that mammograms don't save lives. We have known for decades that we are not saving lives with mammogram. And yet they just scream it louder so that they're trying to drown out the voices of reason. But I think women are waking up. I think women are realizing. And the men would have never, ever allowed this rabbit hole to happen. Ever. Like if you told a man every year that he had to put his, I won't do testicles, I'll do prostate, that he had to put his prostate between two plates and apply 20 to 50 pounds of pressure to it and radiate it. Do you think this program would have ever gotten off the ground?
Yeah. I think men are just tend to not enjoy doctor's visits or be as comfortable as women in general, right? So yeah, I think you're right. Man, I'm going to skip it this year.
Yeah, I'm good.
Yeah.
Thanks.
I'm going to avoid that little squeeze.
Yeah. So in any event, there's mountains of data to show that mammograms do not save lives. And, even if they don't save lives, but they save breasts, that would be a worthwhile endeavor. But when we look at the data, mammogram has only caused the mastectomy rate to increase by 20%. So mammogram is not saving lives or breasts. And it has long been time to abandon mammography because it hurts way more women than it helps. But, I'm not all about trashing one technology to, promote my own agenda. This has nothing to do with me. I just want to be clear that this has nothing to do with me. There are safe and effective and innovative and painless ways to screen for breast cancer that do not put your health at risk, because I don't think it's ethical to take healthy women, and quite frankly, that's the screening population, right? It's women who are healthy, who we have no reason to believe that they have the disease. I don't think it's ethical to expose those women or put them in harm's way. So what I recommend for screening is, the first thing I recommend is, I think every woman should be doing self-breast examination. I think you will no one will ever know you better than you know yourself, ever. Every woman thinks her breasts are lumpy. It's okay. Own your lumps, right? Know what your breasts feel like when they're normal so that you can know what they feel like when something's changed. So that's the first thing. And I will argue that unless you have clinical disease, I'm not sure you need treatment anyway, right? So I don't so much believe in screen diagnosed cancers. However,
I just want real quick. So self-examination, do you cover that in your book, like the right process to do that?
Mm-hmm.
Okay.
Yep.
Yeah.
And also, if you follow me on Instagram, I'm at Dr. Jenn Simmons, and my Jen has two N's. Pinned up right at the top of my Instagram is how to do a breast examination. The second thing I do is I use something called the AURIA test. I don't know if you've ever heard of this. This is an at-home test that takes 5 minutes to do, where you sample your tears. So there's a tiny litmus paper that you put right underneath your eyelid, close your eye for 5 minutes, take that paper out, send it off to the company, and a week and a half later, you get a result that is either normal or clinically significant. Now, what it's looking for are two inflammatory proteins that are precursors to breast cancer and seen in the very early stages of breast cancer. So these are the S100A8 and S100A9 proteins.
Excellent.
And if you have enough of them, it will trigger this clinically positive result. Now, the sensitivity of this test is 93%, meaning that it is more sensitive than almost any other screening modality that exists.
Wow.
Okay. The specificity is 58%, meaning that 42% of the time when you don't have breast cancer, you're going to have a clinically positive result.
Mm-hmm.
I want to be clear. There are no false positives here. If you have those inflammatory proteins present, you have the inflammatory precursors to breast cancer.
Mm-hmm.
And what you have now, everyone who has a clinically positive result needs to go get imaging.
Yep.
They need to go have a professional breast examination by their provider, and they need imaging. If your exam is negative and if your imaging is negative, what you have is opportunity. You have the opportunity to prevent a diagnosis, because if you do nothing, 11% will develop breast cancer in the next 6 months, and another 11% will develop breast cancer in the next 6 months, and on and on. This is absolutely an indication that you have the precursors, the inflammatory proteins that lead to breast cancer.
So just to be clear, you do the AURIA test, you're looking for the S100A, 8, and A9 proteins.
Mm-hmm.
If you show a positive for those, you should get imaging. And if your imaging shows up negative, and you're going to have a recommended imaging, I'm sure, if it shows up negative, you still need to do something, right?
You do.
This is
You
one
do.
of the things that you're talking about is even if you get this kind of positive diagnosis on the AURIA, your joy is that you get to help people live their healthiest lives.
Yes, that's exactly right. I get to help people prevent a breast cancer diagnosis. So of course, I have my book, The Smart Woman's Guide to Breast Cancer. That's what you see over my shoulder, and that's available on Amazon. But if people want to take action, I developed the breast cancer prevention program, and people can learn about that on my website at realhealthmd.com. But this is your opportunity to prevent a breast cancer diagnosis. What could be more empowering than that? And for a lot of people, this is going to be their warning shot across the bow, right? This is going to be their wake-up call. This is their chance to live a far better life than they ever imagined. Because even me, when I got my diagnosis, like, I thought I was a healthy person, right? I was playing 2 and 3 hours of tennis every day. I was competing. I thought I was in good shape, and I didn't realize how sick I was. I had no idea. No idea. I also had no idea about how potentially healthy I could be. At 56 years old, why did I say my age? At 56 years
You
old,
don't look it, probably.
I am healthier.
That's a flex.
I am healthier than I ever was. And as it turns out, my biological age is 37.
Which
I
test?
am 19 years younger. I use Function Health. I use Mark Hyman's platform. Yeah. I am 19 years younger than my I'm going to be 57 soon. So I am almost 20 years younger than my chronological age, right? I would have never, ever, ever gotten here had I not gotten sick. Mm. And now I'm giving the people the opportunity to not have to get there, right? Like, I don't want you to have to suffer a life-threatening illness in order to be healthy. Unfortunately, a lot of people don't make the change until they're forced to make the change.
Yeah. Yeah,
right?
That is true.
That's most people. So let's get back to imaging, because I think that that's a really important part of the picture.
Before imaging, so so your recommendation for how often to take the AURIA test, right? What would you say that is? Is that
it's once a year, unless you have some reason to believe that you're high risk.
Perfect.
right?
And then you get a positive and you have a recommended scan that people should do.
Yes. Yes. So I personally recommend a QT scan. This is new technology. I did not invent this technology. This technology was invented by Dr. John Clock. It uses sound waves transmitted through a warm water bath to collect data points, 200,000 times more data points than MRI, and it creates a true 3D reconstruction of the breast without pain, without compression, without radiation. So in a 20-minute spa-like experience, you can leave with the knowledge that you've had the most technologically advanced breast cancer screening imaging, all without suffering, because I do not believe that we should ever have to suffer to screen for our health, right?
Yeah.
So there's only, I have 2 centers, one outside of Philadelphia, one outside of San Francisco. And my centers are called Perfection Imaging, and perfection is spelled with QT in the center after the QT scan. There are 6 other centers across the U.S., but I am opening 50 centers in the next 5 years. So I am going to make sure that everyone who wants access to this screening tool gets access to this screening tool. And quite frankly, even people who aren't doing the AURIA exam, most women have been so conditioned to want imaging that they're going to do it whether I say they need to or not. Because I really do use the AURIA test. And I really do believe that if you have a clinically normal AURIA test, I really do believe that all you need is physical examination. I don't think that everyone needs imaging, but we have been so conditioned to think that we need to do everything we can to screen for breast cancer. So most women want imaging. And so what I'm so privileged about, why I feel so privileged, is I am allowing them to do that in a way that is so compassionate and current, right? Like the people that are still recommending mammogram are not reading the room. They're not. And the people that criticize me for going against mammogram are also not reading the room. Women want better. They're demanding better, and they don't want to be hurt in the process. So this really will forever change how we screen for breast cancer, and I'm just so privileged to be a part of this movement. Now, I understand there are only 8 centers available in the United States right now, so an ultrasound, a conventional ultrasound, will suffice.
Okay. You would recommend that over a mammogram?
100%. I never recommend screening mammogram ever for anyone. Now, I want to be clear. The words you say matter, right? I never recommend a screening mammogram for anyone. If you have a lump in your breast, if your breast looks different, if you have nipple inversion, if you have a new symptom, any of those things, if you have nipple discharge, this is not a screening examination. This is diagnostic.
Yep.
This is diagnostic. And for diagnostic, I am recommending mammogram, ultrasound, MR, like whatever you need to make that diagnosis, I am recommending. Because if you have clinical disease, first of all, you need to speak the language of the people that are going to help you. And there aren't a lot of breast surgeons. There are some, but there aren't a lot of breast surgeons who are literate in QT. And so you have to speak their language. You have to do what they know how to deal with and read and help you with. So I believe in that conventional system for those purposes, right? I also believe that in 5 years, the conversation is going to sound much different. In 5 years, it's going to be, show me your QT scan.
So I have conversations with, founders and people, doing amazing work like you're doing regularly. And it seems that conventional medicine hasn't caught up with the technology. Is a lot of this stuff out of pocket? Does insurance cover anything we've talked about, like the ARIA or the QT scan?
So the ARIA test is very inexpensive, and it's at auria.care, AURIA.care, and you can use my code, which is Dr. Jenn 20, DRJENN 20, to get 20% off, which makes it a $130 test.
Okay, excellent. And then the QT
The
scan.
QT scan, depending on where you have it done, is anywhere between $500 to $600.
Okay.
So it's nothing like what an MRI would cost, right? An MRI is thousands of dollars, and that's what it's most comparable to. It's not comparable to a mammogram. It does everything a mammogram does and more. It does everything that an MRI does and more. It is the only modality that has functional capability, which is why I believe in it so much. So if we see something on QT, and I want to be clear, I'm not talking about the person that comes in and has a breast mass and we do a QT scan and we see something. That person is getting referred because if you are symptomatic, I think you should be part of the diagnostic system that exists, right? Right now, we just don't have enough literate people in the QT space to manage that. But if we see something that you don't feel, that no one feels, we are bringing you back in 60 days, in 2 months, rescanning you and measuring the volume, because this is volumetric measuring as opposed to like 7 by 9 millimeters. We're actually measuring the volume of these lesions. And from that, we are able to do a cell count and a doubling time. And if you have a doubling time of more than 100 days, we know that this is either not cancer or not important, and we tell you to come back in a year. If you have a doubling time of less than 100 days, this is something that needs attention, and we send you appropriately. So there's no significant delay in diagnosis. This person is asymptomatic, so no one's hurt by this process. We didn't give them any radiation. We didn't give them any compression. We didn't traumatize them. And we can know definitively.
They had a spa experience.
They had a spa experience. I mean, literally, this is what women say. Like, if you go on my Instagram, these women say, I can't believe it. Like, I feel like I was at a spa. And I did that very intentionally because I want to take the pain, the fear, the cruelty, the trauma out of breast cancer screening because it doesn't have to be that way.
Yeah. What a great idea. Wow. Okay. So I want to be kind of respectful of time. Is there anything else that maybe we didn't touch on that you think is important about screening and perfection and everything?
Yeah. I just want to say that, and we touched on this a little bit, we have so much more power than we think. We have so much more power than we've been led to believe. And we have so much more control over our health than is being shared with us, right? And if you are living your life in a thoughtful, awake way, you really can create health. Most of us don't do that. Most of us are actors in our story rather than authors of our story. And when you shift from being an actor to being the author, you are met with great reward. And that was the major shift for me. And that's what I'm doing with people now, is I'm teaching them how to author their story.
Excellent. I love that. Become the author. We've talked about become the CEO of your health. I like become the author of your health. I think that's awesome. All right. So I have some fun wrap-up questions.
Okay.
We'll do these kind of rapid fire. Do you have a target age that you want to live to?
So as a devout Jew, I can tell you that what we talk about all the time is that we bless each other with 120 years. And that's because Moses our leader, lived till he was 120. And so I know Asprey has has aspirations to live well beyond that, but my aspiration is to live 120 good, healthy, productive years. And at 120, I should only die young.
Yes. By the way, when I interviewed Dave Asprey, I asked him that question. He said, I want to live and then I'm going to go into a cave and I'm going to astral project out of my body and who knows when I'm going to die. So it's a little more nuanced than 180. How long do you think humans can live?
You know, I think that there's a reason why our lifespan is decreasing, and that's because most people, again, are walking around living life without intention. But I do think that humans can live to 120, but it needs to be a life of intention.
Yeah. You need to have
And
a
a
focus
life
on
of
that.
purpose, right?
Yeah.
We only hang around for as long as this world needs us, which is why it's so important to live a purpose-driven life and to stay with that. My mentor, JJ Virgin, talks about being relevant. And she knows that she is going to live beyond 100 years because she's going to maintain and make sure that she maintains relevance.
I like that. What are 2 to 3 protocols, habits, mindsets, let's call them shortcuts because everybody likes shortcuts, for longevity and a long health span that you would share?
Yeah. I think that one of the best things that we can all do is live in circadian rhythm. So get up with the sun, get exposure to natural light as quickly as possible. So get up and get out into natural light. See that natural light several times through the day so that it signals hormones and hormonal health. So midday, so that the sun is above you, and we appreciate the position of the sun, and then watch the sunset. Prioritizing sleep. And something that we didn't talk about, which I think is so important, is hormone replacement. Because now we are living well past our reproductive window, and the only way to live well and healthy beyond our reproductive window is to do hormone replacement. And I am a huge proponent of bioidentical hormone replacement, both in the non-breast cancer population, where we know it decreases your risk of developing breast cancer, and in the breast cancer population, where we know those women live longer and better lives.
Yeah, I think that's really well supported by data. I've had an interview about it. It was actually a topic that I wanted to get to. I just felt we were doing such a good job of really the front end, right? Of, hey, how do we assess breast cancer and what are the safe ways to do it? So we kind of steered it that direction. What are 1 to 2 things people get absolutely wrong regarding longevity and a long health span?
Yeah, I think that there's like a lot of orthorexia going on about diets, right? Like, I have to be on this diet, and this is the only diet, and this is the diet for longevity. And people miss the fact that we are all bioidentical, right? And so, bio
Yeah.
individual. We are
Yeah.
not bioidentical, we are bio individual. And so the diet that's right for you is not the diet that's right for me. And there's also a huge divide between what's good for men and what's good for women. So to say that there's one diet that's right for everyone, I think that's really, really wrong. I also think it's really wrong to believe that there's one diet for you in your lifetime. I think there are seasons, and that
Yep.
things change. And the other thing that I think is missed, although it's talked about more, is we are over consuming. We're over consuming light. We're over consuming food. We're over consuming air. We are over consuming, and fasting from light, from air, from food, from warmth. All of these things contribute greatly to longevity, to your flexibility, to neuroplasticity. And we're not talking about them enough. People don't die of starvation. They die of indigestion. Too much.
I like that. Dr. Jenn, how can people contact you?
So my website is realhealthmd.com, and there you can learn about all of the programming. You can get my book, The Smart Woman's Guide to Breast Cancer. If you like what you heard, I have my podcast. It's called Keeping Abreast with Dr. Jenn. You can get that anywhere you get your podcasts. If you are interested in the imaging that I talked about today, it's Perfection Imaging, PERFEQTION, imaging.com. And there you can sign up for your scan and learn all about it. I'm on all the social channels at Dr. Jenn Simmons, and my Jen has 2 N's. I think we talked about The Smart Woman's Guide to Breast Cancer, but that's the book that I wrote for women who have a breast cancer diagnosis. But there's also all the prevention information that you need inside of the pages of that book. And I really did pour my heart and soul into that book. And it's a very unique perspective because there aren't a lot of people who spent 20 years as a leader in the conventional breast cancer space who did a 180 and learned about the functional medicine space and the integrative medicine space and put out a comprehensive guide to get the best of both worlds. So it's a really important book, and I hope that your listeners take advantage of it.
Very cool. And what in the near future are you excited about?
Oh my God, I have so much going on. So I am opening up 50 perfection imaging centers.
Awesome.
My next book, called The Forgotten Woman, which is focused on how to recover your life after a breast cancer diagnosis and get the health that you want and deserve. That will be out in 2027. So I'm very excited about that. And just continuing my mission, because I know that God put me here with great purpose, and that was to forever change the way that we diagnose, the way that we treat, the way that we screen for breast cancer. And I know that what I'm doing here is going to not only save a lot of lives, but prevent a lot of heartache.
Excellent. All right. You can find her realhealthmd.com. Keeping Abreast is the podcast. Perfection Imaging, that's PERFEQ. We'll obviously, TION, we'll obviously have that in the show notes. Find her on the socials. Dr. Jenn Simmons, that's 2 N's. It's DR, right, for doctor? It's not spelled out.
DRJENN.
Excellent. Dr. Jenn, this has been spectacular. Thank you so much for joining us today.
Thank you for having me. It was an absolute pleasure.
I hope you enjoyed this episode of the Live Beyond the Norms podcast. Make sure to subscribe and follow. Also, make sure not to be that guy, the guy sharing this podcast with people who are not interested in living beyond the norms. If you would like to learn more about the ESS60 molecule, the molecule responsible for the single longest longevity experimental result on mammals in history, a full 90% extension of life, visit myvitalc.com. That's myvitalc as in carbon.com.